Good afternoon and welcome to the last session of the Elets Third Diagnostic Leadership Summit. This session is a panel discussion on focus on accreditation and quality for enhanced diagnostics. And we have Dr. Ravi Gaur, Principal Advisor, Spice Health, Founder, Dr. G. Path Labs, Co-Chair, CI Delhi Chapter Health Committee, who will be moderating this session. Welcome, sir. We have Dr. Simi Bhatia, Director Operations of SRL Reference Laboratory and Technical Director for Network and Fortis Lab Medicare. Welcome, ma'am. We have Dr. Puneet Nigam, Senior Vice President, Medical Services and Quality and Chief of Services, Metropolis Healthcare Limited, North India. Welcome, sir. And Dr. Sunita Deshmukh, HOD Lab Sciences and Blood Bank Paras Hospitals. Welcome, ma'am. Over to you, Dr. Gaur, for the discussion.
Good afternoon, everybody. It's my pleasure to be here and for this panel discussion with the experts and the leading and it's a well experienced quality professionals who have been leading the various institutions. And welcome to this session. I think I'd like to thank Elet also for this kind of a wonderful event they have created, and with the theme that creation of futuristic diagnostics. And I mentioned yesterday the similar thing because that's this. What could be the better time than today? When today, like everybody is talking about, the diagnostics, and I think diagnostic is now taken a center stage. Although still at some point, 3 years, 4 years, 5 years back, probably if you look back in the hospitals or somewhere, the space we were given one corner space in the hospitals and lab. But today, of course, their hospital want to showcase their potential diagnostic. Like this is what best we have. I think COVID has done a wonderful change, and the future is going to be ours. I'm pretty sure about it. But when we talk about future, there are two important things. Of course, one is the technology, and the second is the quality. That's going to be there. I think so. The importance of quality is definitely growing up day by day. I'd like to, although the welcome all the panelists once again, and we have with us, I'll give you the Dr. Simi Bhatia, Technical Director at SRL Fortis Labs from Mumbai. She has a wealth of experience of running the labs, the quality in the labs, and functioning of the lab, and probably all natures of lab, bigger hospitals, small hospital, of varying size, of various nature, whether it's the high end or the low end pathology. Welcome, Dr. Simi.
Thank you.
We have then with us Dr. Sunita Deshmukh. Dr. Deshmukh is head of the department and lab services and blood bank Paras Hospital. In fact, she's again a wealth of experience, probably almost over 3 decades, and she's seen the entire journey, and currently heading the entire Paras group. It'll be a pleasure to hear you, Dr. Sunita, and welcome to the session.
Thank you.
Also, I have Dr. Puneet Nigam. Dr. Puneet Nigam is a Senior Vice President, Medical Services and Chief of Lab Services, Metropolis Healthcare, North India. I think he has all the journey, probably, I don't know, because I may not be wrong, but I think he may be one of the person who has actually seen the very few labs which were accredited some time back. And after that, the whole things have changed. But maybe the first, second lab, probably he has gone through the accreditation. So entire journey he likely to cover. And that's a question I'm going to ask you as we move forward. Welcome, Dr. Puneet, and pleasure to the session.
Thank you,
Also, I have Dr. Neha Rathore. She's a consultant microbiologist and senior quality manager, QRG Medicare, Faridabad. Dr. Neha is a microbiologist by profession, but again, in fact, today, microbiology is actually come in the forefront. That's where the infections have come up for the forefront. And I think it's going to play a very, very important role, because at some point in time, we have forgotten about infection. We always talked about NCDs, the various communicable disorders, I think non-communicable disorder. But today, I think COVID has realized that infection does exist, and parallelly, we have to work parallelly in both of them. So what's the role of quality and how it is important here in this aspect? We like to, go forward and probably share some insights with Dr. Neha. Welcome, Dr. Neha.
Thank you.
Thank you. Before I start the session, I'd like to just say, two important. The session, the theme is focus on accreditation and quality for enhanced diagnostics, because that is where the enhanced diagnostics is definitely playing a very, very important role. and the strong growing focus on accreditation. At one point of time, you realize we hardly had, it was still in the country, which is like, if it almost 1.5 to 2 lakhs labs we have, accreditation of labs was not more than about 3,000 labs. COVID has actually, of course, accelerated that pace, and we had about again 2,500 COVID the accredited labs, and that's something the journey. I think momentum one need to accelerate, and the focus has come back on acceleration. I spoke something yesterday, like, if you look at the search engine optimization, when we do that in Google, like Google Network, you select 10, 15, 20 words, and they just come on the top as you keep doing that. And in today in healthcare, that's exactly, if you look at the top 10 words, the first probably if anybody's search is going to be COVID, that's fine. Second is going to be think about pandemic. That's everybody talking about what nobody knew about it. COVID, pandemic. Then comes about RT-PCR, the commonest neighborhood. Everybody know, do you do RT-PCR? They don't know what RT-PCR, but they know the test something like this exists, RT-PCR, RT-PCR. And the next is, the accreditation. They all talk about, are you ICMR accredited lab? ICMR accredited lab. That means accreditation is now back into focus. People want to know about accreditation. Are you accredited? And as we move forward, now they're talking about QR codes. I think everybody, you have a report has a QR code, So these are the 5, 6 important words. They're coming to the top in the healthcare today, wherever you go in the common man's language. So that means focus has come back, and the new technologies like even QR codes, they're adding to the more of the enhancing the quality of diagnostics. With this, I think I move on to this session, or today's session. The welcome everybody again. So, what is quality? I think that's something. Some say clearly it's the right result, or it's the other way. I mean, it can be converse. Can you having the result right? So that's something which is like we need to talk. Or is it lack of errors? Or what about improved? Or in terms like improved outcomes? Surely that got to be the most important. How do you measure the quality standards? I think that's something all of us we know the quality, but I think coming to a definition which is agreeable to all, I think that's the most important question, and that's where probably accreditation systems help. Like the like when you can say like we are all pathologists at FIT, I always say, and we all sit behind the microscope inside the labs. So I think if we somehow today feel, oh, if my microscope could speak and does give me an alert, I'm seeing a slide, it start talking about something. I think that's the enhancement. Enhanced technologies can help us out. Probably the future is going to be like that. A lot of things are happening on that space. As we move forward, we will discuss in session. So with this, I think we'll go for the session straight away, and I will have a 2 round of questions with you. We have each question you have about 5 to 7 minutes to answer, and and after that it's going to be purely interactive. And any of you have to add something or to the other panelists' answer, you can always raise your hands, and I think we'll take forward. So my first question goes to Dr. Simi Bhatia. Dr. Bhatia, welcome again, and I'd like to have basically one first question to you. Now, what is accreditation, and how does accreditation helps to improve efficiency and quality of labs? I think you know the best because you are running multiple hospital labs, and which is, I think, accreditation has become it is mandatory almost in the chain what you're really heading. Welcome, Dr. Bhatia. Please, your views, please.
Yeah, thank you. Thank you. Totally with you that accreditation is something we all need to know. So, if I look at the different definitions of accreditation, which would be more in medical terminology, it says independent third party evaluation of a conformity assessment body against recognized standards, conveying formal demonstration of its impartiality and competence to carry out specific conformity assessment tasks. Now, this becomes very, very technical, but at the end of the day, what is it that accreditation, what is the goal to get an accreditation? How does it help us? So, basically, the goal is to meet acceptable levels of quality. What does it do for the laboratory? When we say we need to do accreditation, it means it improves patient outcomes, mitigates risks, it helps us in the process of identifying strengths in the lab, And hence I have always told my people, please do not take, accreditation means an audit. Audit is not an exam. It is not just somebody coming to look at what are your gaps. It is to tell you where you could improve processes. It is to look at your strengths also and tell you, yes, you're doing a good job. So, whenever you are looking at accreditation and an audit process, it is to confirm and build your confidence and trust that what you're doing is right, and at the same time give you inputs on data improvement. So basically it also fosters a culture of quality and safety, because today accreditation is not just for the equipments or the test or the technology, but an accreditation process also helps in promoting staff empowerment, because you're looking at people, what are their abilities, what are their qualifications, their experience. You're giving them training so that they can be better off, and also at the same time looking at safety protocols for people. As we all know, the amount of safety that we took for our staff and ourselves during COVID time, that's a living example which we've just experienced, where every time we walked into our lab and somebody was not wearing a mask, we said, please wear a mask. So that was very, very critical, because at times, we are never used to wearing a mask and people would say, I get suffocated. But then people got used to it. So I feel that accreditation is a process which is meant for every aspect of lab testing, whether it is pre analytical, analytical, or post analytical. It is meant for every process, whether it is equipment, manpower, IT, biomedical engineering, HR, everybody. So that is what accreditation is for a laboratory. Now, how does this improve efficiency and quality, which was your second question? Now, how does it improve quality? Because you start developing standard operating procedures for everything that you do. As it is always said, it is the man behind the machine that is important. But at the same time, we have to remember that anything that we do should be documented so that the legacy of good work is carried forward. It should not fall down, it should not deteriorate. So, to have a standard operating procedure which identifies each and every aspect, right from, when you're looking at a test, from where do you buy your reagents, who's the vendor, what is the pro and con of that kit that you have bought, why have you taken that vendor, so vendor evaluation, all those SOPs are something which contribute to quality. So quality is not driven by just one parameter, there are multiple parameters, and it is a multifaceted process involving multiple people, not just the lab people. Everyone needs to contribute so that the quality of our testing is world class. Quality can also be got if you are having somebody who's going to be ensuring that you are documenting your control parameters. And at the end of the day, we all have feet of clay. If you are not monitored, then you say, okay, I'll do it tomorrow, day after, and that never comes. So quality, when you have a program, whether it is an internal audit, whether it requires or internal quality control, which is monitored, it ensures that you're confident about your results. And today, with the aspect of medical legal cases, so you have something to fall back on. It cannot be just a subjective area. There have to be certain areas that we need to be backtracking to ensure that if there is a variance or a question, we are able to fall back to systems and processes to address it. And at that point of time, we are also able to identify, was there a gap? Was there a slip that happened, so that we could take the corrective and preventive actions to prevent the recurrence. You also ensure that you put in place certain reassay protocols, because there are certain times you need to redo the result, reevaluate the result before releasing it. So again, that helps you in quality. And when you monitor this, it also helps in efficiency, because you cannot have, see, efficiencies is also financial efficiency in today's corporate world. It is not just technical efficiency. So if you're going to be monitoring what are your reassays, what are the problem samples, what are the types of, when is it that tests are not performed, that would help you improve your pre-analytical variables also. Then when you're looking at the analytical, giving out critical alerts, asking for histories, correlation of results, all that also brings about improvement of quality to the customer at the end. Today we are at a point where customer experience is plays a very important part. Healthcare is not just giving results. At the end, it is a happy customer, a good result, which matters. And definitely, when we are looking at accreditation and quality interface of equipments to prevent manual errors, that also gets you efficiencies in the system. So there are various aspects and various protocols that we need to do to ensure that we get quality and that gives us efficiency. Now, as I had said earlier, whenever we are looking at this process on accreditation or audits, we need to also tell our people that it is a peer review. And that's an advantage of an audit or an accreditation, because if it is not somebody who's coming to take an exam, and from there we can learn a lot. I mean, the experience of people in this panel, if we interact and they come to my lab, I would learn from them. I would know what's happening outside, so then I can improve my processes and they also take back what we are doing. So it is sharing of information and good practices. All that will again help us in getting efficiencies, because I may not know everything, I may not be able to think everything. So this all these aspects would help us in improving efficiencies.
Okay. Thank you, Dr. Semi. I think you have very elaborately and very comprehensively defined the accreditation and how does it help. I think I always see that, quality is a journey to perfection. And, basically it's the accreditation recognizes a lab's commitment to excellence and high professional standards of operation. I think that's something you summing it up. The excellence is achieved through an ongoing process of learning and improvement, and that's a journey. Probably accreditation helps us to achieve that perfection. Of course, in healthcare, there's never a perfection. We always aim to have perfection, and we have no option but to be perfect. But still, I think this is the journey what we have. Like say, accreditation improves the facilitation of accurate and rapid diagnostics, efficiency of treatment, and of course that's the most important part, the clinical outcome. Actually, it has to be right. That's what we are here for, because we believe that the cap has a tagline called "Every sample is a life." I think that's something what we look forward, and that's what we are supposed to be. The outcome has to be the best, and reduction of errors in the lab process, of course, a very important part for that. So I think accreditation is not about who the best is, but who has a system of standard procedures with aim to improve the quality and the patient safety and the outcome. I think that's exactly what we are focusing on. We should be focusing on. That's what we need today. Thank you so much. And with this, I will come back to you again and talking about something more. What are the newer things which are happening today? But I move on to my next question to Dr. Puneet Nigam. Uh, Puneet, you have seen been this entire span of journey. So that is, I think, I like to definitely address you that question. How's today's accreditation different than the accreditation of 20th century? We're in 21st century now, and probably you can always say that what is going to happen in next 10 years, because I think the whatever we are seeing in to come in next 30 years, COVID has actually advanced it. I think probably next 5 years, things are going to be changing in processes. Like we never thought of a virtual audits, but I think some great about some 2000 virtual audits had been done by you all, and they're successfully being done. But then it got on pitfalls also. In any case, that's a different thing. But I'd like to answer you, how's the today's accreditation is different than the accreditation of 20th century? How do you see this today to change, and how do you see the future? Dr. Paneet, please.
So thank you, sir. So it's really a long journey. If I have to walk on that path, 20 years ago, I think accreditation in the country was a new beginning, and the accreditation body, the labs, all were very enthused that we are making a new chapter, in the healthcare, in the laboratory, with a long vision that we will reach something where developed nations have already made a lot of progress. So there was a lot of enthusiasm. There was a lot of ignorance, but they say ignorance is bliss. And when you start on a journey where everybody is kind of equally ignorant, it becomes very enjoyable. So there was no fear of assessors. Assessors were also very friendly, very experienced people. So when the journey started, initial 3 5 years, lot of learning transmitted, where the senior team members went to the labs, encouraged them, motivated them, guided them. Then after 5 years, then expectations started to rise, and the accreditation body also was much better established. There were guidelines. They could review their own data, what is working, what is not working, where labs are failing, where labs are doing, where labs have become too smart, and so all this was happening. And the good thing was that people who started early, they had a similar frame of mind. See, in India, accreditation is voluntary, which means that this is a challenge that you invite for yourself. So it is like climbing a mountain. People who want to climb a mountain will start on that journey. Other people can go by car, by the road. And second thing is, business anyway can be very good. So there can be a lab who's hugely successful in terms of business and may opt not for go for accreditation without hurting his business prospects. But there were few labs who wanted to do good business and also wanted to take that path, because that is the path we saw that developed nations have already taken. So it is like a benchmarking, and we knew that being in developing nations, eventually we will have to catch up. And if someday we want to become a superpower in healthcare, in lab, we have to walk that path. And in earlier days, we used to have patients, who will go outside and share a report of a US lab and say, see, this is the reading. And from our lab, we'll think, no, our reading is right or wrong. Whether we should be confident, can we fight that American lab? So accreditation has brought all that kind of parity also, because once the awareness of standard happened, the same standard being followed, the same norms being followed, Indian report getting accepted in EU and USA, and our process is also getting benchmarked. So now the scenario is totally different. There's hardly anybody who will go to US to kind of confirm a report given by an Indian lab. That is thanks to the journey of accreditation and the initiative taken by the labs at that point of time. But somehow I feel that journey has led us to only 1200 and 1300 labs, which is really not one would have wished for. We would wish for at least 15,000, 20,000 labs going that path, because there are huge advantages. As Dr. Simi pointed, it's a whole process. It's basically a mindset. So we were always doing well, but when you have a new mindset, you have objective data, you can review it, you have record, you have traceability. It is good for the customer because you can give confidence to the customer. You can share with him a lot of things which are just verbal otherwise. So that change of mindset, I think, is what the accreditation process helps. And I can tell you that we face audit from NABL, and we also face audit from other bodies, pharma companies, CAP. But there is a sweet charm to a NABL audit even now. So even after 20 years, when there is a NABL audit and senior assessors are going to come, and there will be something interesting for us to learn. And that is the charm of getting peer assessors who have got a lot of experience. They have developed certain systems which are differently oriented. So the minimum requirement remains the same, but how you build on that obviously the world is open to you. So accreditation that way helps, and on the other hand, we have labs which maybe are not accredited. And to give the examples, we have some tertiary care hospitals like Delhi AIMS is there or PGI is there, and everybody sends sample to them. They have a degree of specialization, world standing, but even now they are going the path of accreditation. So the requirement that your business targets, your excellence targets, your academic targets, if they all come in the framework of accreditation, then it definitely helps, I have no doubt. And we have seen within our groups that the labs who are accredited, the labs where we have assessors, people who are trained on the standard, there is a definite degree of awareness which is of a different order, and that only happens because we have created a system, and that system works. It is not individual driven, it is a system which is at work, and that is the best part of the implementing a standard. So rather than individual driven excellence, it becomes a process driven excellence.
I
Now
think,
this,
yeah, please
yes,
carry on. Yeah.
yeah, no, please sir, comment.
I was saying you rightly said it's a system driven because I think when is today is the era of you have multiple labs like in the metropolis you have a chain of labs. One lab is referral labs, regional labs, satellite labs, hospital based labs, and you can't be present everywhere. So if you put your systems in right and you have the checklist right, probably that is something which is going to create you be have a probably a blissful night to sleep. Otherwise, every time you're alert, like, oh, what's happening? I am a lab director. I am a pathologist out there. I don't know what's happening in my lab. Even remotely, I think today you can monitor that. I think that's something which is probably accreditation will help because and of course, is an era of the consumer protection, legal compliances because anybody, even at least if the processes are right, systems are right, everything is documented, then probably you can be confident about what you're doing. You're in any case very confident as such also, but you have something to back up and show because that otherwise becomes a part of subjectivity when somebody say this is not right, this is not right. But I think when it comes to one thing spoke about the resistance. Actually, yes, when it comes to looking at the quality and making judgments about quality and implementing changes like accreditation system, there's often resistance to that sort of proposal and that sort of processes. It has to be enjoyable. I think it has to be made enjoyable. But today, I think the mindset again, what you said is actually right because whenever even internally, like probably Dr. Semi agree here, or if she goes and does an audit of a lab, she says, I'm coming for the quality inspection. The whole lab's got in the flitter. Oh, where does she come from? Because when we always see them as the inspectors, although that is not the right, they are inspectors, but they are here to improve, hold your hand, and take it to the next level. I think you need to make it more enjoyable. In fact, yesterday's session, we had spoken we had our the NAPH, the CEO and NABL CEO, and they were talking about yes, they need to time to have make it more user friendly. Otherwise, don't be scared of us. We are actually integral part of you. And don't like if you the alert is raised will ban you. No, we don't want to ban you. We want to be with you. Make sure that the alert is addressed right in time. I think that's a great question. I think, and one lastly, you also mentioned about superpower. I think I would like to say India is actually delivered in COVID time because
Yes.
nowhere in the world you'll find that so many labs, COVID testing labs have come up and so fast, and all of them as compliant with ICMR, NABL. In US and somewhere the results were coming in 2 weeks or 10 days, but we are still able to give result in 24 hours. I think hats off. I think we are now probably the leaders out there, and we have to make sure that we continue to build that. And accreditation can definitely take us to that level. Uh, Now, coming, I think the next speaker, thank you, Dr. Puneet. We'll come back to you again. I have my next speaker. We have Dr. Sunita Deshmukh, and again, she is wealth of experience and knowledge and all kind of a scenario, whether the OPD labs and IPD labs, hospital labs, blood banking, and So, Dr. Sunita, I think the new technologies as we are getting into it, you have seen probably, I'm sure, must have done started from mouth pipetting onwards, semi-automation, making controls in-house actually from the labs, and of course the whole thing is now changed. Probably we have a you don't even sometime I dream of maybe we don't have a people in the lab, the robots going around. I don't know. I mean, it's a futuristic thought, but I'd like to ask a question to you. I think a lot of things have happened over time, and one of the things inside the lab, what has happened is the automation of the systems actually, or the processes are even like. So how automation helps in accreditation and improve our quality of diagnosis? If you can share your insight and experience, that'd be my pleasure. Dr. Sunita, please.
Yeah, thank you, Dr. Gaur. As you have said, I have really seen labs functioning uh, everything used to happen manually, right from reagent preparation, and things have changed so much in last 30 years. And now automation is the key word. Without automation, I don't think anybody can think of running a good lab without automation. Automation definitely helps in accreditation. Accreditation, we have spoken a lot about accreditation, how quality is maintained, and to monitor the quality, how accreditation is required. As we know, accreditation involves extensive documentation. If a thing is not documented, then it is as good as it is not done. See, when assessment for accreditation happens, it is not that whatever you are doing at that time the assessors are watching, but they also want to see all your previous records. So unless you are into practice of keeping the records, unless you are in the practice of following the process and keeping records, one really cannot function properly on the day of assessment audit. So for this extensive documentation, the first thing that comes to my mind is for accreditation, the documentation that is required. Uh, with automation, it has become much easier. Lot of documentation can happen in within the analyzers only. In automation, the record keeping and record retrieval has become easier. Like one doesn't have to spend time in plotting the IQC revisioning charts. The automated system will immediately give a warning of rejection, so that appropriate action can be taken, and that saves time and accurate. The reports are accurate. And the documentation, automation definitely improves your accuracy and precision, because there is least manual intervention. Everything happens within the system. There is high degree of accuracy is obtained. There is no reagent preparation, no pipetting. All reagents are ready to use. So plus whenever a sample is to be run in dilution mode, no need to dilute the sample outside. One can just give a command and reflex dilution happens, and correct result is obtained in less time. In case of breakdown of the equipment also, the operator gets a list of actions to be performed. So one doesn't really waste time in taking action. One gets help from the analyzer itself. And all these are documented also. One can get a list of what all breakdown has happened in the system. See, all this definitely helps in accreditation. All these records have to be maintained. Then pre-analytical variables are also can be monitored in the automated systems, like lipemia, clot in the sample. The machine will automatically detect it and will not process the sample. So thereby will not waste your time, will not waste the reagent. It is very helpful. And automation, in accreditation, everything is one has to keep records of quality control. So for simple tests like urine analyzer and ESR, where timing is very important, one has to actually one has to actually keep a track of the time, whether 60 minutes are over, whether 30 minutes are over, while even for ESR, even for whether it is a urine strip reader or microscopy, uh, no machine can replace eyes of a pathologist, but with the help of the automated analyzers in hematology and in clinical pathology, body fluid microscopy also, the confidence is increased. And of course, turnaround time is very fast. One can maintain the turnaround time. So automation really helps in accreditation.
Thank you,
So
Dr.
many.
Nita, because I think very, very pertinent and very, very, like important points you have mentioned here for the automation. And I think one is, of course, the manual intervention. It gets away because whenever there's no subjectivity, you probably minimum manual interaction will happen, and you can define the processes very well, and you can actually do the real-time tracking of those processes because that's are there, and these records are automatically created in the back of the instrument probably going forward because I'm sure as we move forward, probably the next decade with the integrated pathology labs or integrating system, and I'm sure we need not even keep all the record; they will be rightly uploaded into NABL portal there, and you don't have to really because that's something which is probably could be the future, and that will help you to give you right alerts at the right moment. I think another area what you mentioned about is the confidence to us. Yes, 100%. Because individuals are like we have a staff people, we have technicians, we have other workers in the lab. So they are all to subjectivity something, although they may be very well trained. But I think if you have a somebody who's the flawless, probably absolutely just have a checklist, 10 things to be done. Without that, it will not move. I think that adds to our confidence. Actually, probably it's a more of a augmented intelligence to the eyes of pathologists who actually can not only see what's really in front, what's happening inside the machines, what's really happening. You can track that and come back, and probably that can really help us in keeping our track and documents in order and our checklists in order, and that will probably minimize the challenges with the face with the accreditation. And safety is another important aspect you mentioned. I think very good because when you have fully automated track and belts, probably you don't have to be doing much. Probably this whole system is fully automated, and the staff safety. You can use the staff for more productive work and critical alerts. Again, you mentioned about it. The moment there is something happening in the system, critical alerts are probably straight away passed to the RMOs. Otherwise, a missed report is always a missed life sometime. So I think these are there are many automation issues I think you mentioned, but I think these are the important. And moving forward, I really feel that there'll be more. But there is been a debate about somebody talks about will the labs will be replaced by the robots. Will we find some kind of a robot instead of like what we see into robotic surgery or maybe something in the various the new generation movies out there? No, I feel uh, robots today also exist inside the machine. They are working, we're not able to see, but we may be able to see virtual robots probably carrying sample from one to another place, doing repetitive work. But I think more than robot will have something called cobots, collaborative robots, which will likely work with you in your hand. And we really can't replace our pathologists and technicians. That's going to be there forever. And that's the probably the automation. We have to have learn to be with the work with automation, and we have learned well, and I'm sure we'll do forward. I think thank you so much. I'll come back to you for the next question in the second round, and now we have our young panelist, Dr. Neha Rathore. Dr. Rathore, we now you have been like the recent generation. Of course, the journeys I think all of us have seen, but I think you are probably you not have done a mouth pipetting. I'm sure you should not have seen probably how Dr. Nita was making reagent and controlled by herself, but I think you probably have seen the packs now. But I think I like to talk to you, ask you one simple question: what are the new age technologies or enhanced diagnostic technologies which are used in lab nowadays, which are helping in improving the lab quality and keeping us ready for inspection at any point of time? Your answers, please.
Okay. So, sir, like the enhancement they have brought in diagnostics is they have creeped so stealthily that when this topic came to me, I just started thinking. So the very basic instrument is a barcode generator. If you see, so with the advent of like maybe so enhanced diagnostics have been here for last let's say 15-20 years back. So when we had a barcode generator, it sort of removed all the errors pertaining to sample labeling. And with today's machines, there is a biphasic reading. They can read directly not only the patient demographics, but what all tests have to be done. And as ma'am told, like it can generate alerts if there are high values, low values. So linking of barcodes with these instruments has opened enormous opportunities, which sometimes we are not able. They keep going in the background and we don't even come to know. They have actually improved the reporting in such a great extent that our lives have been, every time you don't have to go and check whether it is the same sample. You can do a delta check, like there are many quantitative parameters which get repeated like every second day, or maybe in terms of platelets, like you have every day they are being repeated. So with the help of the graph generation, you can see how the values are changing, and you can come to know if there are any errors, like ma'am said, clotting and lipemia. And one more thing, you can also find out if the disease is going in some particular direction, if there is a sudden change. So these are very small things which have happened, and they have changed our lives in they have made it so comfortable, and it has given us so added confidence. So starting from barcode, then the instruments, they have enormous analytical capacity. Sometimes by hit and try also we come to find out that this is a tool which we can use in generating our LJ charts, finding the CV values, all these things which we require for accreditation, and giving us confidence into what we are reporting is right. So not only abnormal results, accreditation and flagging, all these things are done. And auto dilution, like there are many samples which need to be auto dilute. Earlier what used to happen, that okay, this is the result, this is the value, oh, this needs to be diluted, and a lot of time used to get wasted. So now you can program these instruments to auto dilute after a certain level. You can fix the parameter and the level, and these can be auto diluted. And at the end of the day, you know what is the path it has taken. You can carry out further analysis based on that. Now, from if you see, these are the analytical part, but the post-analytical part, it helps in rapid dissemination of information. So I am sitting here in front of my computer, and my system has been interfaced with the equipment. And the moment there is a new result added, I come to know it is there, and I can always check. I can we in my hospital we have see, if in terms of microbiology you see, so microbiology reports like as a routine thing, they are delayed because we have to grow the organism, so it takes more time. So next day reporting or 48 hours reporting. So every time a clinician sends a blood culture, he is just thinking ki kya positive aayega, kab aayega. So I have to change my treatment pattern. But with these things, you can send alerts. A gram negative is grown. Next day, you can send the entire sensitivity and ID. So the rapidity with which the information is disbursed without causing an error in between has increased tremendously. And all the data can be, if you see instruments, they store the data in certain formats which can be changed into Excel. So you can analyze it later on also and find, like suppose there is a new test you want to validate. So based on that, you can based on the data created, you can find out what is the cutoff, what should be the cutoff. So these are tremendous possibilities which have made our life so simple, and without even sometimes realizing you are doing things uh, which are just great. And they have, as you said, every sample is a life. So every sample being treated in a similar manner, It gives you a great confidence. It's also driving a paperless revolution, sir, because most of the values system, even now, the nowadays patient is receiving, SMS from our side. Whenever the report is finalized, they receive a SMS, so they don't have to call the lab or come ki bhaiya sham ko aana, kal milegi. So all these things have revolutionized the diagnostic approach. The clinicians are also having, they also own that ki, this is the tat, and I'll receive the report in this tat. They also feel okay, we have to brief the patient the next day, and we know we'll have a report by that time. So I think small instruments, even you don't need a huge instrument for that, starting from a barcode to a simple analyzer, they have they have changed the whole world.
Yeah. I think that's interesting insight, because I think this is the era of information technology, when everything is like coded, and and the I think probably we have seen that the people coming back to the lab for collecting reports, that era looks like getting over. And I think, but still, of course, we need to continue, because the people want to discuss the reports with you. So it's more of a physical visit. They want to talk to you, and clinicians will definitely like to talk to you, because at some point of time, it was in many labs. I don't know. I think many of you agree, but I've seen that pathology labs were basically where all the clinicians used to come to the lab, when in the hospital especially, for a cup of tea, because whenever they finish their round, they used to come to the lab, or let's sit with you and discuss the reports, and take even the download. But today, I think that's not really happening, because that's something which is like everything is virtual. It goes on a WhatsApp, or a link is go report. They can see that, they can track the report, the trend of the reports. The graphics and smart reports are much more. And of course, the barcoding has definitely reduced the demographic errors and all the challenges. Unique ID has been created. We have our honorable Prime Minister talking about National Digital Health Mission. Unique ID has been created. I think these are all areas, probably, if we have a full tracking end-to-end available, probably definitely going to help us. There are many such technologies which are coming, especially like sample, the trends, actually, and tracking what's happening inside our lab and system. You can have a look. So these are something which is important. I think I like to say at here, it is some technologies what we have seen. I started with something like digital pathology today. When the pathologist is seeing a slide, probably they is also sometimes you miss out some 20% of point, although there's an entire checklist, still is subjective. So there are now digital pathology platform. They will actually give you oh, you're supposed to see 100 items in this slide. You have only seen 70. You have missed out two, probably. So it's something, they immediate alerts are given to you, so that you can focus on that. Or they identify certain areas on the slide. These are the suspicious areas. Please have a relook again, or please look, so that becomes like a little easier for the pathologist to focus on the suspicious area, not really focus on the necrotic area sometime, or time waste and time. And then, of course, you can say that real time inventory, probably another area, probably we have seen that nowadays, which is also like done by our certain softwares. Then I will come back to you again, Neha, with I think some more questions. And I'll go back to Dr. Simi for my second question. And probably the important question today is, like, when we have all these technologies with us, and we know what's accreditation. Now, when we know all, if we adopt these new technologies in our labs, do we still require accreditation, or we can continue with the technologies and be happy with that? Your inputs, please.
No, definitely, accreditation is needed. Only thing what will change is the checklist and the process. Because how do we do accreditation? That is because there is a checklist. So the checklist depends upon the process that is being followed for that particular equipment test. So when we change the technology, definitely the checklist will change, the way it is going to be validated will change. Like you mentioned, digital pathology. Today, digital pathology has come up in a big way, and CAP and NABL are definitely going to give accreditation to labs. They've already started giving accreditation to labs doing digital pathology. Only thing, the difference is the checklist is different. The way you are going to be validating, a digital pathology report is different. So accreditation has to continue, will be done, so that as all of us have agreed that accreditation is something which will help us in building confidence in our result and good customer experience. It will help patient outcomes and also help we pathologists to mitigate any risk that we carry because of reporting. Very often, what happens is that you are sitting in a reference lab, you do not have the history, you have a patient sample that comes, you have a value, connecting with the clinician may not be possible, or when you want to report it out, the clinician does not, because he's got so many patients at that point of time, may not be able to remember the history of that patient. So if you're reporting something, you always may not be able to have a clinical path correlation, and hence you would put a comment saying rechecked the value and then reported it out. So when you are looking at a monitoring based process and accreditation, that is very critical, irrespective of whatever test technology you change. Today also, when you change a kit, a test methodology or an equipment, you are doing certain processes to check the the precision accuracies we are doing in lab, intra lab. Automation will have its own ways to do check the video points, and these will have to be looked at through an accreditation body to ensure that we are doing things right.
Well, thank you, Dr. Simi. I think yes, that really says that your vendor is is like accreditation. Come what may, whatever technologies we feel, we should have an accreditation, and that's actually gives you a confidence in what you're doing is correct, and probably you're ready to be, you can say that is our commitment to excellence. And anybody can inspect at any point of time. We have done our job, and we are right there, and that's probably accreditation can. It's probably will be required for almost everybody as we move forward. Dr. Puneet, I'll come
That's
back now.
just one point. I just want to
Yes,
repeat what
please.
Dr. Puneet said, that during the course of our years in whether it is Metropolis or SRL, we face many audits, and they're not just technical audits by NABL and CAP. You have so many pharma companies because of the clinical trials and the co-marketing work that you do. Why are you confident about it? Because of the process that we have all incorporated in our day-to-day working, and that is validated by an accreditation body. So then, come what may, we are confident that anyone can come, as you rightly said, and inspect us at any given time, and we are ready for it. So, no change should prevent this good process that India has started. I think it was in 1996 that NABL started the accreditation process. I remember I joined SRL and how hard we worked because we knew nothing of the process, what is meant by quality, what checklists to be done, what formats to be made. And today, when we go for accreditation of smaller labs, we share that with them, because that's how we would ensure that our entire, the entire pathology network has the same standard. So if I need to get tested today anywhere, any lab in my country, I should be confident about the result, irrespective of whether it is a big lab or a small lab. I think that's what
Yeah, I
accreditation
think
is.
you are right that way. I think it's now, but I think still what probably the bigger chain, of course, the labs are doing in any case have a mentoring the smaller lab, overseeing the big lab and mentor the small lab, and between the two labs, probably many of the smaller labs actually in the group areas I've seen in the city, and they're having a own quas program and peer group program, but still not NABL. But I think and that's some kind of accreditation. But of course, we require an official accreditation, which is recommended. But yes, the very important point here is like big size lab can always adopt and have a some kind of a mentor some smaller labs and help them to uplift the quality, and that's probably because accrediting 1.5 lakhs is not a job, because it's not an easy job. It's going to be 1-2 generation probably and more than that. But I think by this we should be able to do something back to the labs, which are neighborhood labs. We can probably club and put them together into some plan and help them out. Okay, thank you so much, Semi. I think come to Dr. Puneet. We have about 10 minutes, probably have the 2 minutes each to you. The I like one simple, because you are into, you have collection centers, you have all kind of a thing. So I mean, the samples are picked up from right reference center and transported. So how does technology influence to reduce, because major errors are also in pre-analytical space. how this technology has helped to influence, reduce the pre-analytical errors. Your take, please.
So, sir, we all know that in the three phases of the lab, the pre-analytical is the biggest devil because it is outside the lab, and now we are working in wide geographies. Thanks to COVID, the labs are now in the interior of country, going to district level, village level, and we where you sit in a lab physically, everything is like under camera all the time, but where you have remote locations, collection facilities, to have the same kind of visibility was always a challenge. And it is not possible to have so many supervisors and monitors placed in all these locations. So other than adopting some technological means, it is practically impossible to ensure. And that is where technology is kind of supporting the drive to quality and to operational efficiency both, because both are basically two sides of the same coin. So if you become operationally correct, efficient, your quality automatically improves. So as previous speakers have said, in the examination, the process is somebody has to collect a sample. Now there is a sample collection requirement. How do you train the team, every team member, that collection requirement is conveyed and the implementation is done? Many a time, despite giving monthly trainings, we will find that somebody will forget a critical step, and a sample will come, lab will test, the reading will not correlate, and then the doctor will talk to the doctor and find, oh, this miss has happened. And it doesn't happen, but it prompts, thanks to the cycle and the system which is built, that why this has happened. So continuous training is one way, but to using technology, like now we have in a, say, LIS or some of the apps that have been created, somebody punches a test, there is a pop-up that you have to collect this tube. This is the requirement, please communicate to the patient. So even without training or with the chance to forget and miss, there is a prompting which is going on. So this really helps because otherwise the compliance always has a lag period. And we know in a group there will always be a Gaussian distribution. So we may have 5% doing excellent, but we will also have a tail which is not doing excellent. And that tail is contributing to a lot of dissatisfaction, errors, and quality issues.
Yeah, perfectly well said. I think that's an area, because I think pre-analytical space is one important space where training, continuously hammering on them, and because they are the guys, the phlebotomists out of the field, and we need to keep a strong eye on them. And I think today we are talking about transporting, because across India, right, left, and center, right temperature sensitive strips, data loggers, virtual tracking of samples, which was actually was not really happening, because it was really happening earlier into the we were taking care of our the material which come on Amazon online, where it is reach, but sample they were not really able to tag. But that's some more important than anything else, surprisingly. But I think now time has come. The new software, the on cloud software, real time record is happening, and labs can take a track of recording and prepare yourself also with that. Somewhere there, maybe because during the transit temperature must have gone up and then come back, who knows. So that quality of the report will definitely be better, because if temperature the sample deteriorated somewhere en route. You understand probably better than me, because you're in and out of the lab for so many years.
Right.
Thank you, Dr. Puneet. I will probably have next question to Dr. Sunita. The thing Puneet touched on the pre-analytical phase. I'd like to touch you something on the analytical, I think, quickly in 1 or 2 minutes. How this analytical is something getting better day by day with the use of technology. Dr. Sunita, please.
Yeah, with enhanced technology, with the adaptation of enhanced technology in laboratory diagnostics, basically starting from barcoding, enhanced LIS, and biophasic uh, interfacing, bilateral interfacing of all equipments. the analytical errors are greatly reduced unless there is a basic error at the time of punching the test only. Otherwise, the chances of error are completely minimized. One more thing I want to say that with the advanced technologies, one gets reminders for calibration well before time. That has also reduced the chances of errors. And e-connectivity of equipments. Equipments can be monitored from remote location by the concerned company people, and they can also trace what is happening in your system, and if there is any probability of any breakdown or any error happening, they can immediately alert you and come and make the necessary changes in the equipment. That is how technology helps.
That's very important, I think, point you mentioned. I think remote maintenance of the equipment, I think, very, very, very valid point. Because really, like, and that's, I think, anytime something like COVID, we have seen the machine breakdown, what do we do? The engineer somewhere in Ludhiana and not in Delhi, what do I do then in situation? Probably they can help us out. Yes, I think that's a very important point. I think one quick point I'll put across. This is the era of continuous monitoring devices, something what we talk about, wearable devices, eras now, POCT devices, at home services, what's really happening in the data. I think, and remote pathology we're talking about, we have 1.5 lakh, I'm sure another 50,000 would have been added into the COVID time now because people feel that diagnostic is getting more important. So probably, but we have only 20,000 pathologists, maybe less than that, practicing pathology. How do you handle that situation? I think this is something which is probably, the technology is going to be analytical errors probably, because we need to really keep a track of it. I think I'll ask Dr. Neha about that as the next question. But one thing, Sunita, just quick thing, and in your experience, you have actually noticed that analytical errors, because although they are almost the minimum component of the errors when it comes to the entire errors in pathology, have they gone down what 30 years and what is today now because of the automation and what of the technology? And what is the percentage? If you can just give me a broad indication, that'd be nice to understand the implications of technology. Just a small percentage, like if you feel earlier it was 10%, now it is 2%. Any idea on your side?
The analytical errors are reduced by 90%.
That's one. That's what I wanted to really from you. Wonderful. I think that's something we're talking about. Yes, by the technology and with automation, I think analytical errors almost gone. I think for that matter, that's something we're talking about. Thank you so much. My last question, Dr. Neha. I think you have been. I just mentioned about POCT devices, remote kind of a thing. So I think and then the talking about the post-analytical kind of a thing, because reports are now critical alerts you mentioned. So I'd like to understand from you how technology has influenced reduce the post-analytical errors and influence reporting quality, because that's something. Because you mentioned something about smart reports, so I like to, and data what we have. So something your insight and experience on that, because you come from my infection control people and where the hospital microbiology. Your insights, please.
Sir, if you see in post analysis phase, it is very important to share the right thing with the right person, and end to end, connectivity has ensured that. So, patients' reports are, privileged information. So it is very important that they are shared with the right people. And as far as POCT devices are concerned, sir, there was a recent blog by Bill Gates, and it mentions home health. So there would be a time like my SpO2 is being monitored, or my pulse rate is being monitored by a doctor sitting at a distance. Similarly, there are chip-based devices which are coming where I can put my blood sample and they can read things. And with technology, it will be possible to connect the doctor and someone sitting in the remote village, and enhancing the capability of the system to a great extent. Similarly, like simple instruments, they are having a capacity to auto-diagnose errors. So everyday maintenance requires, like, they check the optics, they check everything, whether the printing is proper or not. So even your printer gives you an alert. So these are all part of a continuum, which helps minimizing the post analytical errors, uh, in the sense that we can also do a root cause analysis, like ma'am pointed out that online these instruments can be, in case of a breakdown, can be logged into by the biomedical person, who can actually change and tell us where we are going wrong, so they can cause the RCA also. So there are two parts basically which I wanted to emphasize. One, the instruments themselves have a capacity, like to auto diagnose, to get logged in from a distance. The same thing happens at the patient's end also. So they will have a capacity to send their alerts, send their health parameters to a doctor who's sitting in the corner. And like, we used to have a system where the doctor used to come round in the morning, and then he will check the reports. But this can happen in an earlier phase in the evening, like there's a team who gets the alert and they get into action. So communication, and that has been greatly enhanced. If you see in case of COVID, it is giving early indication to the notifiable authorities where the trend is rising, so where they have to take more more efforts to contain the epidemic. So these things are all happening real time.
Yeah,
And
I think that's very, very
prompt
important point you
action is
raised.
one.
Yeah, very important point you raised about the notifiable diseases, because with that we can really identify, technology can help you identify the hotspots, which is happening on which area, dengue is spreading in which area, COVID is in which area. I think that's post analytical. I think probably we get a faster the report, faster the communication, and the trends in the geographies we can define, and that's very, very important area. But I like to add a small thing, but just before we explore that, the we all are talking about. I really feel the concept of path cafes coming up. We have shortage of pathologists in any case, but remote pathology probably reporting may be something which is happening, because that, how will we get the confidence of reporting? You're sitting in Delhi, or sitting in Mumbai, or sitting wherever you are, what the lab is doing. Probably the fully automated labs with the fully accredited systems and checklists. We have a quality alerts, equas, control, calibration. Probably the virtually tracking in the lab what's happening. That will give you confidence, and that probably can need the country needs today. We require more people to oversee the lab, sitting from say Rotsemi can probably sitting somewhere in Mumbai and have a look somewhere in Pondicherry or somewhere in Andaman what's happening in that lab, and she can fully have a full command control center right here in Mumbai and take care of that. I think that's something, or a POCD devices where you just walk in on a finger prick, you have all controls and checks been built, you have the report with you, and then probably if they want, you can have a click of the button, talk to a pathologist on a Zoom and Skype, and you probably oversee and control functions. I think thank you so much for detailed insight. I think there is with this, I will I like to sum up that accreditation means it's not equality. Doesn't mean by itself. It is a continuous process. It controls everything right from, and technology will definitely enhance the quality of diagnostic and help us accreditation, which is of course one of the important at least some kind of certification to us that what we're doing is correct. Accreditation is not necessarily the end of all answers to everything, but at least there are some standard that labs have to adhere to, and that's where we are. And I like to say that quote: if you fail to prepare, be prepared to fail. I think that is something we need to be ready for, and we require better labs, better service, and better outcome. Thank you so much. Thank you, everybody. It was a pleasure talking to you.
Thank
Thank
you,
you.
thank you, thank
Thank
you to
you.
all the panelists. Thank you to all the panelists for their presence and your, in-depth insights. As a small token of gratitude, please accept these certificates from our end. Can we have the certificates on screen? Dr. Ravi Gaur, thank you so much for being our able moderator yesterday and even today. Thank you so much for your presence. Dr. Simi Bhatia, thank you so much, ma'am, for your time and your insights.
My pleasure.
Dr. Puneet Nigam, thank you so much, sir, for being here today, this afternoon with us. Dr. Sunita Deshmukh, thank you so much, ma'am, for being here. Dr. Neha Rathod, thank you so much for your knowledge sharing. at this platform. Thank you so much, and thank you all the panelists for your presence and time. Thank you so much.
Thank you, everybody.
Thank you.
Pleasure.
Thank
Thank
All the
you.
best. Bye.
Thanks, Manik.